Hey guys, welcome back. Today I'm going to be talking about prenatal movements, and it's going to be a little bit of a quick video today. So, we all have heard how important exercise is for us, in all different parts of our lives. It's no different for pregnancy. Exercising during pregnancy is safe, it's healthy, it's really good for your body and your mind. Some studies have shown that it can reduce back pain, it can help with constipation, and it might even decrease the risk of a cesarean delivery. And so, yeah, for most people, exercise during pregnancy is healthy, it's recommended. Sometimes, if you have a more complicated pregnancy, then your provider might have different guidelines for you. So just check in with them and check and see if they are requesting that you do something specific to your pregnancy. But today I'm going to be talking about kind of for general pregnancy, the do's and don'ts, and some recommendations I have. So some things to avoid. A big one is anything that's going to make you super hot, like hot yoga, or if it's super humid outside, like it can get in Columbus, don't exercise outside that day. It's funny, on this list that the CDC has, they said don't go skydiving, which I think is obvious. But some of the less obvious ones are like standing still for a long period of time. For example, if you're standing up in the back of church or you're standing up doing dishes, like that can cause the blood to pool in your legs. And so maybe if you kind of rocked back and forth from leg to leg, or even had a step stool where you could put your leg up and then you switched legs on the step stool, that could help kind of get the blood moving. And then we'll talk about this one later, but avoid lying on your back as well. And then anytime throughout your pregnancy, let your doctor know if you experience any bleeding or fluid leaking from your vagina, if you have a headache or feel dizzy, or you have swelling in your legs or chest pain. Those are all reasons to check in with your provider and see if things are okay or figure out what's going on from there. A great simple way to exercise during pregnancy is going for a walk. Just like walking really quickly or as quickly as you want to for a mile or 3 miles can be so good for you, and it can kind of form this ritual that you can carry into postpartum, and you can show your baby your neighborhood. And I find that it's just so good for not only for your body but also for your mental health. And so having that as a ritual can be really, really wonderful. Okay, so this is a great picture to show how your baby is probably looking in your belly. So this is what we want the baby to be. It's head down with their back against your belly. So this is optimal position. Sometimes you may have heard of OP babies or sunny side up. So sometimes babies can actually have their back against your spine. So they're facing upwards or facing your belly with their head down. But this is the position we want them in. And so there's a recommendation to kind of think of your belly as a hammock. And so your baby is going to be laying with their back, supported by your belly hammock. And so I guess sometimes if you're wondering like what position I should be in, that can be a helpful way to think of it. And maybe this helps clarify that. It's like if you're sitting like this picture on the left, can you imagine kind of how your baby wouldn't be kind of like supported in the hammock of your belly? So yeah, and then this picture on the right, this is fantastic positioning where you're sitting up straight, your knees are lower than your hips. And some people recommend, if this is a helpful way to think about it, like a pencil sticking out from your belly button or like a flashlight. And is the flashlight, is it shining on the ceiling Like if it was sticking straight out from her belly button in this picture, it would be on the ceiling. But in this picture, it's going across to the wall. So if it's going to the floor or the wall, then that's a great position to be in. But if it's going to the ceiling, then can you adjust to kind of get proper positioning? And I know it's hard. I'm sitting like this person on the left right now, but it really, the position that you're in, so your maternal position can really affect the position that your baby's in, the fetal position. And so if you keep this in mind throughout your pregnancy, hopefully that can cause maybe a bit of an easier or a birth where your baby's in a great position. And there's still a lot of research that needs to be done on this. Okay, so laying down. As we said before, avoid laying flat on your back. So you want to be sleeping and laying on your side. Also, when you're watching TV or on the couch, reading a book. When you're laying on your back, your uterus presses into this big vein, and the vein is returning blood to your heart. So you want that vein to be doing its thing and not be pressed on. So this picture is great. You can see she has the pillows under her knee. It would be even better if she had a pillow under her ankle as well. And that can keep your leg kind of parallel, which is a great position to be in. Okay, and then I'm just going to finish up with some positions, some great stretching positions. If you can find the time just to stretch every night, maybe when you wake up or before you go to bed, it can make a huge difference, like in both your mental health and also your relationship with your body and stress. And it's just a really, really wonderful thing to do. So here are some ideas that I've found especially good for pregnant people. This is cat-cow. You probably have done it before, where you can kind of curve your back like the first picture on your hands and knees, and then kind of push your belly down and lift your head up towards the ceiling. And you could hold maybe each one of those 10 seconds and do it for as long as you like. Just explore it. The second one, lunging, is a great way to stretch. It's also a great way to build strength in your legs. And you can also do this position during labor to kind of help your baby move down and rotate into a fantastic position. So it would be also great if you kind of have built up that strength and were used to this position. And it could also serve you in labor. And then this is a really great stretch. You could do this while you're watching TV. You can do it while you're in the office. You can sit on the floor or in a chair. You can see her doing both. And you just put your ankle on top of your knee and kind of tilt forward as much as you can. And that is just a really great stretch that releases some tight muscles that if they're hard and like tight, they can kind of, your baby doesn't want to like interact with them. It's kind of how it could be explained. And so you really want that to be like loose and open so your baby feels like that they can and want to kind of move through those areas. So that's a really good stretch. So yeah, stretching is just so good for your circulation, for your metabolism, for your comfort. And these are just some ideas, but I really recommend you take the time to kind of figure out where you're tight and find different stretches that work for you to release the tension. So thanks for listening, and we hope to see you on the next video.